Does sleep apnea cause cardiovascular diseases? Sleep apnea is a sleep disorder that is characterized by pauses in breathing or shallow breaths during sleep. These pauses can last for several seconds to minutes and can occur 30 times or more per hour. Each pause in breathing reduces the amount of oxygen that reaches the brain, which can lead to snoring, interrupted sleep, and excessive daytime sleepiness. Sleep apnea is a serious medical condition that can significantly impact the quality of life. Sleep apnea can cause cardiovascular diseases through the following mechanisms. 1. Sympathetic activation. The sympathetic nervous system is a part of the autonomous nervous system responsible for the fight or flight response. Its repetitive activation by apnea results in increased systolic blood pressure that leads to hypertension and its complication with time. Repetitive apnea may also lead to an autonomic imbalance and reduced heart rate variability. Treatment with nasal continuous positive airway pressure, known as CPAP, has been shown to reduce blood pressure during the day and night. CPAP treatment of patients with sleep apnea and heart failure or congestive heart failure resulted in the reduction of systolic blood pressure and an improvement of the left ventricular systolic function. 2. Intrathoracic pressure changes. Although both the heart and lungs occupy limited spaces within the thoracic cage, the breathing dynamic of the lungs results in changes in the space it occupies, and therefore, affects the space occupied by the heart. These breathing dynamics result in changes in the external constraint of the heart function, blood volume redistribution, direct systolic ventricular interaction, due to an increased pressure by the pericardium, and afterload of the left ventricular. An increased intrathoracic pressure limits the ventricular diastolic loading, resulting in increased direct ventricular interaction, which may limit the filling of the left ventricle. This interaction between the heart and the lungs may explain the association between sleep apnea and cardiovascular morbidity. 3. Oxidative stress, inflammatory mediators, and endothelial damage. Hypoxia is a condition associated with a reduction in the level of oxygen available to the body's tissues. This condition is commonly observed in patients with sleep apnea. Hypoxia triggers an inflammatory response and an increase in innate immune cells such as neutrophils. These cells secrete reactive oxygen species or destructive proteinases that are responsible for tissue damage, including damage to the tissues of the cardiovascular system, and endothelial damage leading to defects in vascular formation. 4. Abnormalities in coagulation factors. Blood platelets play an essential role in coagulation, thrombosis, and wound healing. Hypoxia can promote the activation of platelets, and therefore, increase their blood content. Several studies have shown a strong correlation between the increase in platelets, thromboembolic complications, and worse outcomes of cardiovascular events. It was also reported that blood viscosity due to platelet reactivity is increased in patients with sleep apnea in the morning. 5. Metabolic syndrome. Metabolic syndrome comprises related diseases such as obesity, hypertension, diabetes, and dyslipidemia, which is abnormal cholesterol or triglyceride levels. Having one of these conditions significantly increases the risk of serious disease, including cardiovascular morbidity and mortality from coronary heart disease and stroke. Several studies investigated the relationship between sleep apnea and diseases related to metabolic syndrome. A study investigated the correlation between obesity and apnea and found that 60% of obese patients had sleep-disordered breathing and 27% had sleep apnea. Another study reported that 60% to 90% of patients with sleep apnea are obese. Regarding the relationship between sleep apnea and hypertension, a study found that about 40% of patients with sleep apnea suffer from hypertension. An association between diabetes and sleep apnea was investigated by a study that found that patients with sleep apnea have increased glucose levels and increased insulin resistance. Although dyslipidemia is a known factor contributing to cardiovascular diseases, a relationship between sleep apnea and dyslipidemia has not yet been established, and future studies will certainly investigate a potential association. In conclusion, due to the complexity of the factors involved in the relationship between sleep apnea and cardiovascular diseases, the management of patients with sleep disorders requires the involvement of several healthcare professionals, including a sleep specialist, cardiologist, primary provider, otolaryngologist, dietitian, neurologist, and pulmonologist. Treatments also exist, including CPAP, autotitrating PAP, bilevel PAP, adaptive servoventilation, positional therapy, lifestyle intervention, example, weight loss, upper airway surgery, upper airway neurostimulation, oral appliances, and bariatric surgery. Unfortunately, these treatments may prevent OSA but cannot treat some of the underlying causes that require other types of treatments. If you enjoyed the video, please like, subscribe, and share for more videos like this.